everybody, it's Dr. Maria from Vet and Probably.com. This is Henry. He's about 11-year-old indoor-only cat. He's a male neutered. He's about 15 pounds. We don't see Henry an awful lot, so we don't have a really good history on him. But his mom came in today with him limping. She thought he was limping. When I put him down on the exam room floor, he's really weak and he's dropped at the hocks, meaning he walks on the back of his back leg. So cats should walk on their toes, and he's walking what we call plantigrade. So his whole back foot is on the ground. She also said that he's just sitting by the water bowl. So there's a lot that we learned in his history. Indoor cat, overweight, drinking a lot of water, and plantigrade stance. So the first thing I thought was diabetes mellitus, which has become very common in indoor cats. So the first thing I did was run a blood glucose. His number was 513. Can you see his number? Yeah. So he's, his sugar is very, very high. He should be somewhere around 80 to 120. That's normal. So because of that, he's halfway got his diagnosis of diabetes. The other part of having a diagnosis of diabetes is a urine sample. Cats with diabetes will drink a lot, therefore you pee a lot, therefore the concentration of your urine will be very dilute. So this is his midday sample, and it's not dark yellow. We really want, your kidneys should be concentrating your urine and you should get a nice dark yellow. So we are gonna do an in-house test to see if there's sugar in this, and then he will have his diagnosis of diabetes mellitus. With indoor cats, I really focus all of my energy on getting them off of carbohydrates, so off of dry food, onto a really high quality canned food. I also add water to it. I really want to undiabetes them. I think if you're very aggressive and you catch it early on, there's a good chance that some of these cats will not need to go on insulin. We're going to run a full blood work. Unfortunately, we see a lot of concurrent infection, urinary tract infection, sometimes even systemic infection with diabetes. And until you get that sugar under control, you're not going to get the infections under control. So I always start with a long discussion about what diabetes is. I really want them to change everything they're doing with this cat. So more exercise, really strict diet, remove, if possible, dry food from the diet and stay on one of the prescription diabetes diets. And then he'll come in every 2 weeks or so to get his blood sugar checked so that we can help get him back to the normal numbers. It can be a really frustrating disease. You've got to stay in touch with your veterinarian. You've got to ask lots of questions. You've got to be prepared to change your lifestyle and your environment. And these cats can do very well. And there's certainly a significant number of them that if you're aggressive and if you're diligent, you can undiabetes them. It's not so much in dogs. It's certainly much better in cats, but getting them up and moving, getting them on wet food, making sure fresh water is always available, watching the litter box for how much they're urinating. That's a good way for you to figure out how high their blood sugar is. And then keep in touch with your vet. I'll do another video later on how to check a blood sugar at home, but you should buy a glucometer. We use a special one for cats and dogs. And you should be testing at home as often as you can. If you have any questions about diabetes, I have a lot on my blog, Diary of a Real Life Veterinarian, or you can ask me on Probably.com. So we're going to wish little Henry luck, and we're going to get him on a new diet and lifestyle and hopefully get rid of his diabetes. Take care. Thanks. Bye.
Say hi, Henry.
Say bye, Henry.
Such a handsome